Warts, verrucas, and calluses, as we mentioned, are common skin conditions that, while usually they are harmless, they can cause.
One thing I heard growing up is that warts and verrucas are caused by frogs and toads.
So, what the treatment involves is it involves removing. Welcome to Consultation Room Podcast.
Welcome to today's episode. Now, let's be real, we've all had them at some point, but no one ever talks about them. Yep, today we're getting into warts, calluses, and verrucas. Now, before you start pulling a face, stick with us because this is actually really interesting. Did you know that some warts have their own blood supply? Or verrucas are basically icebergs chilling under your feet. And don't even get us started on some of the crazy remedies that people swear by. So if you've got a wart that just won't budge or a callus that can survive the apocalypse, don't you worry, we've got you. What causes them? Are they contagious? And most importantly, how do you get rid of them? We are going to be answering all of your questions today. Stay tuned, you don't want to miss this one. So as a start, Steph, what are warts? What are calluses? What are verrucas? What's the difference?
So, warts, verrucas, calluses, these are all skin conditions. So they're very common. And to begin with, I'll just start with warts. So warts are small, rough lumps or growths on your skin. They're caused by a virus, HPV, human papilloma virus.
Yeah.
Due to the virus, it makes them contagious. They can appear anywhere on the body. And due to the virus, that means that they can spread from one part of your body to the other. They are mostly common on the hands and the feet. And they're also mostly common in children and teenagers, but anyone can have it. Most people have had it at some point in their life. They usually go away on their own, but many take months or even years. When it comes to warts, there are different types. So we have common warts, we have plain warts, we have filiform warts, and we have one called plantar warts. So plantar warts, as many people know it as, are verrucas. Verrucas are basically a type of warts that appear on the sole of your feet. So the growth usually tends to grow inwards due to walking on your feet and due to the pressures that walking usually causes, and they can be quite painful. And warts and verrucas, as I said, they are contagious, but unlike them, calluses are not contagious. Calluses are basically thickened, hardened patches of skin that develop from repeated friction or pressure. They're the body's way of protecting itself and usually found on the hands or feet.
Yeah.
And as I said, unlike warts, calluses are not contagious because they're not caused by a virus. So I have mentioned a few of some of the symptoms that may occur with warts, verrucas, and calluses. But Trudy, do you mind just telling us the symptoms, how one can actually differentiate between them? Like, how do they appear?
So as you said, these are normally characterized by small raised rough bumps on skin. So it's almost like a growth on a skin, but not quite a growth. So the three of them will appear as that. You will see some sort of like raised bump on the skin, and they will be hardened as well. Now, when it comes to warts and verrucas, they will be raised, rough bumps, and they are grainy and maybe even uneven in texture. And they can be flesh colored, or they can be either lighter or darker than the skin surrounding it. So if you notice that maybe there's that raised growth of the skin and it's maybe the same color as your skin, it doesn't mean that it's nothing. It could mean that it's either a wart, a callus, and of course, if it's an area where there might be friction, there's an area where there might be pressure. So it might be either a wart or a verruca, but of course, if there's an area where there's pressure or friction, of course, it could be a callus. They could also come in clusters, warts and verrucas, or they could just sort of appear as solitary lesions. So they could appear as just one single wart, one single verruca, or they could appear as a cluster. So you might have a cluster of warts maybe on your hands, or maybe a cluster of them on your feet, or just the one single one on your hand and your feet. So not to mean that if you have, a few, raised lesions on or raised bumps on your skin, on your hand, it is definitely a wart. No. It could mean that it's something else, but they can present like this. Yeah. Also, sometimes warts and verrucas can be itchy and maybe cause some sort of mild irritation, especially when there's some pressure that's been put on that area. Or even let's say there's a clothing that's sort of like cause friction on that area. So sometimes, let's say you wear your socks, because of that friction, it can cause some sort of like itchiness, some sort of irritation, mild irritation. And the same applies to the, to the warts, a bit of pressure. Maybe if you're holding something, you might feel like maybe they're itching, maybe a bit irritation as well. This is a symptom of warts and verrucas. Whereas with a callus, it's not necessarily it's not the case, but of course with time, this can be the case. There could also be pain when it comes to warts and verrucas, so especially when you're weight bearing. So the same sort of pressure you will apply and feel some sort of itching or irritation, it could also lead to some pain. Yes. So this is both on the hands and the soles of the feet. So most of the time, if you have a verruca and you're walking, you might feel a little bit of pain because of that pressure on that area. This is a symptom of a verruca, and if of course it's on your hands, it's a symptom of a wart. And also there could be bleeding. So some warts and verrucas do bleed, or even crusting, so they can crust as well. And most of the time this is when they have been scratched, or maybe there's some trauma that has been applied on the area. This can cause them to bleed, or even this can cause them to form a cluster. So if you scratch them, or as we said, because they are caused by a virus, if you scratch them, of course you're opening that skin, and that can lead to sort of spreading of it. Therefore, they can form a bit of clusters. So this is very common with warts and verrucas, but not the same with calluses. So calluses, as we said, is not really caused by a virus, so it's not contagious. That's one of the difference between the three. So calluses are not really contagious, and so there won't be any sort of like spreading, if I may. Whereas warts and verrucas can easily spread. That's right. I think one last sort of symptom of something like a callus is you might notice that it's maybe a little bit more widespread than maybe a wart or a verruca. Warts and verrucas sometimes tend to be a bit smaller, but a callus can be maybe very, very big. So if it's a bigger area, it could mean that maybe it's actually a callus. But not to say that, any raised skin that is, larger than, I don't know, maybe larger than a coin is definitely a callus. Normally what we say is go to a healthcare professional, get that checked, come to the pharmacy, we're your friends, guys. We will have a look, and then we will maybe give you, an idea of what that could be. But always get that, diagnosis from a professional, because you don't want to be using treatment that is not really suitable for whatever it is that is going on. Talking of treatment, what is a treatment for these things? What's the treatment for warts? What's the treatment for calluses? What is the treatment for verrucas? Do we have any treatment?
Yes, there are treatments. So I'll put warts and verrucas together, then I'll go into calluses. So warts often go away on their own, as I mentioned earlier, but this can take up to 2 years because warts can spread, cause pain at times, and affect your day-to-day life. Due to this, we may offer treatment. So when it comes to treatment, we have products OTC products such as creams, gels, and medicated plasters for treating warts and verrucas. And these products all contain salicylic acid. What this chemical does is that it helps to dissolve the layers of the warts over time. So that means that you may need to use this medication daily and for up to 3 months because it usually takes a while to go. If the warts become sore, very sore during treatment, please stop
Yeah.
treatment for a few days and then go back to it. So these are the OTC products, and they're so common that you will find out them.
Yeah.
Another option that you may find is cryotherapy. This involves freezing the warts off with a liquid nitrogen. And then we do, of course, have some home remedies. So there are some home remedies out there, which I'm sure Trudy has heard of. So we have something called
Mm-hmm.
duct tape method. So this is
Mm-hmm.
basically covering the warts with like a duct tape, which can sometimes help remove it by basically irritating the skin and thereby stimulating the immune system to basically fight off the virus. So
Yeah.
once these methods have not worked, your home remedy, your OTC product, you do have the option to seeing the GP. So the GP will see you if, for instance, the warts or verruca is painful or bleeding, or you have a wart on your face, or you basically have a lowered immunity, or you have loads of warts covering a large area. So that's when you need to see your GP. Or even
Yeah.
if like maybe like the growth changes color or shape, or you have some sort of like other condition going on, maybe you're a diabetic or something.
Yeah.
But the GP will recommend they may either recommend you to see a dermatologist if, for instance, it's on your
Mm-hmm.
face, or they may recommend you to see a podiatrist if, for instance, it's on your feet, if it's a verruca and it's getting worse and basically nothing they've offered is helping you. So the
Mm-hmm.
podiatrist might recommend maybe a stronger prescription medication. So or they may actually offer like surgery to remove off the warts or verruca.
Yeah.
And and also there is an option of like laser therapy as well, which also takes off the warts and the verruca. So
Yeah.
these are the options when it comes to the treatment for warts and verrucas. When it comes to calluses, I usually say calluses just requires you looking after your feet or your hands. So if you basically need to be doing like a manicure and a pedicure. So what the treatment involves is it involves removing like the buildup of the skin, and this would require you to soak the area in warm water until the skin softens. So once this is done, you could get like a pumice stone or a foot file just to remove the dead skin gently, not harshly, gently. And
Yeah.
once that is done, you could moisturize the area just to soften it. So look out for products that contain urea or ammonium lactate, or my favorite, glycerol, coconut oil, or shea butter. These are very important because they
Mm-hmm.
soften the area very nicely. And
Yeah.
once that is done, you could also opt for the option of like padding or shoe insets just to relieve the
Yeah.
pressure. Yes. But these are the main treatment when it comes to calluses. Um, there are other ways to also help you when you do have calluses, verrucas, and warts. So these we would mention as the preventative measures. So, Trudy,
Yeah.
what are the preventative measures that an individual can take?
Okay. I think you've been very thorough. And actually, whilst talking about calluses, you've actually talked about some of the preventative measures when it comes to
Mm,
calluses. So, as you've said, money pedis are your friend. You know,
yes.
if you have certain jobs that require you standing for more long hours, or you normally wear very uncomfortable shoes at work, two things. you need to get better shoes, or you need to get a different job. But if that you can't change either of the two, then it is very important to invest in a good pedicure or even a good manicure, of course, if the callus is on your hand. So that is one of the preventative measures when it comes to calluses. Another thing when it comes to calluses is, as women, we do wear our heels. And unfortunately, because of the way the heel is, the heels are made, they will almost push your feet right to the tip. And what can happen is, because of that pressure, you might find yourself having calluses. So most women actually do have calluses. So taking breaks whilst wearing heels is very, very important. That will prevent you from having calluses. As much as we love our heels, they might not always be our best friends. So that is very, very important as women. Taking breaks from wearing heels, or men as well. Taking breaks, men who wear heels, from wearing heels as well. It's very, very important in actually preventing calluses. And as you said, Steph, moisturizing regularly, keeping the feet clean and dry, that will prevent calluses, because as we said, it's that pressure, it's that friction. So what you want to do is, after a long day, if there's been so much pressure on your feet or on a specific part of the feet, you clean your feet, not just that area, clean your feet properly, but also moisturize them. Maybe give yourself a nice little massage while you're at it as well. And also exfoliating, but also making sure you're doing this very gently, because we're not going, as much as you might have the exfoliation stones or they use now gloves and like creams and things like that. Please be gentle on your feet. Okay. That is very, very important. And I think what I'd actually say as a final way of preventing calluses is using protective padding, or even like things like gel inserts when you're wearing like uncomfortable shoes, or when you have a job that you're on your feet for long, or even a cushion. So if you have a job that requires you to apply pressure on a specific part of the body, it's very important to maybe invest in a cushion just to protect that area. So basically, when it comes to calluses, the only way to prevent calluses is to prevent excessive pressure, excessive friction. When it comes to warts and verrucas, first I'd say is don't scratch, and also don't pick your wart or verruca, because as we said, they are caused by a virus, so they will end up spreading. So this is actually not just preventing getting them, but also preventing the spread of them, because you can maybe very easily get rid of one, but when you have several of them, it gets a bit complicated. It takes a bit longer. They don't, they don't just go overnight, unfortunately. They don't go away overnight. It takes a while. So preventing the spread of them is also very, very key. And if you're someone who bites your fingers, bites your nails, or even sucks your fingers, this might be when you need to stop doing that, especially when you have warts. And, some people suck their toes, or, get their partners to suck their toes. Maybe avoid doing that during this period is very important, because again, this will actually cause them to spread, So also keeping your fingernails maybe very short, because then you're not scratching some of these areas where you might have warts and verrucas, is very important. Also, don't share nail files, clippers, anything to do with nails. It's very important that if, say, you're a household and someone has a wart or a verruca, they it might be best that they use their own set, because as we said, this can spread. So you're preventing spread by not sharing tools like this. And I can't emphasize this enough. When you're going for your mani pedis, invest in a good salon, invest in a good beautician, invest in someone who you can trust, who sterilizes their tools, doesn't just use the same tool they've been using, from Monday. On a Saturday you go, they've not been sterilized, they're still using the same tool. That is very, very important. So again, this establishment can actually be where you get some warts and verrucas. So if you run a salon or this kind of establishment, please make sure you're sterilizing your tools, because warts and verrucas can spread easily this way. What I'll also say is, if you shave, especially one group of warts we probably didn't mention, or we just mentioned in passing, is something like genital warts. If you shave around that area, and maybe you use, I don't know, the same shavers for, I don't know, your beard, this could spread. So maybe not shaving around these areas, or being very careful to sterilize the tool after shaving around this area. And I don't know, some people have, very hairy hands, and you might want to shave as well. And if you have warts on your hands and then you're using the same shavers for other areas, again, this can cause spread. So avoiding shaving around the areas where you have warts and verrucas, or just not shaving these areas and using the same shavers for other areas might be a way of preventing spread of warts and verrucas. What I'd also say is keep your feet and your hands clean and dry. That is very, very important.
Yes.
Some people, and we know these people, we won't name and shame, but some people even at work, when I see I'll go in with a bag of crisps, and I don't know why. Sometimes I don't know why I feel I have to share some things, because sometimes you shouldn't have to share your food, And I'm like, do you want some crisps? The way this person will pour their hand in your crisps, and their hygiene is not up to scratch. That's how you're getting your warts and your warts and verrucas. Because sometimes if someone has a wart and they've not washed their hand, they've not kept their hand clean or whatever, and then they're dipping into your bag of crisps, and then now you're going ahead and eating these crisps, of course you will get this infection. So it's very important to keep your hands clean and dry. But also, if you have a wart or a verruca, please cover these areas. Get a plaster, cover the areas that you might have a wart and verruca, especially when you're out and about, or especially when you're around people, because these, as we said, can be contagious.
Exactly.
People who go swimming, please listen. Don't go swimming with your hands flip-flopping around, Cover these areas. If you have verrucas, please put a plaster on these areas, because this is, again, how they will spread. So preventing spread of them is very, very important.
Yes.
And talking of communal areas, if you go to the gym, you are likely to actually get the three. So weightlifting, because of the pressure you put on your hands, you can actually get calluses on your hands. So please wear protective gloves. That's very, very important. Protective gloves are very, very important with calluses. And of course, wearing the right shoes, that will prevent you from getting calluses in your feet.
Yeah.
When it comes to warts and verrucas, when you're going to, for that quick shower before you go to work after hitting the treadmill, please wear flip-flops. I can't emphasize on that enough, because I've seen this enough, and the amount of times I just look away, because I'm like, if you know what you're doing to yourself, you will not be walking in there barefoot. Because I've seen girls in the gym literally run in, run out, bare feet, and just get on with their day. You don't know what you're stepping on. As we said, these things can spread. So please wear protective footwear when you're out in public, when you're in public washrooms, public, swimming pools, things like that. It's very, very important to protect your feet. So the gym is a place where you can literally get the three of them. Okay. But guys, please go to the gym still. And what I'd like to add finally, if you want to prevent warts, verrucas, don't share your towels, don't share your socks, don't share your underwear. Stop sharing these things, guys. Let's keep clean, okay? Let's start, let's make this a normal thing where we don't have to share some things that we don't need to be sharing, okay? If you know you have verrucas, please make sure you, after, maybe even do your laundry separately. I'm not saying they can spread like that, but it's just a precaution. That way people will know this is actually serious. The people around you in your household will be like, okay, I can't just take the socks there just because, they wore them for 2 minutes. I can't just wear them. So just doing things to prevent the spread will be the best thing that you can do for yourself and the people around you. Is there anything, Steph, you'd like to add when it comes to prevention or...
No, you've literally covered it. Like, the most important when it comes to warts and verrucas, as you said, is basically personal hygiene. So, like, basically wash your hands, don't share objects. Those are the main things. And also with the calluses, basically prevent like less friction or less pressure on like the area. If it's your hands or your feet, wear some protective gears like gloves and stuff. So you've literally covered everything. So that was spot on. Yeah. In terms of like, I would say in terms of like wards, it's quite important that people literally practice this personal hygiene so much,
Yeah.
because when it comes to personal hygiene, like we cannot emphasize that enough. Like
Yeah.
wash your hands. But yeah, you've literally covered everything. So yeah, that's
Mhm.
it for me. So we've pretty much been through the most important things. So I know there are some misconceptions out there, some myths out there. So let's debunk some of them.
Mhm.
Um, I've only got like two main ones. I know there's quite a few. You probably have quite a lot, so but I'll just
Right.
mention one each for like warts and verrucas and calluses.
Mhm.
So to start off, what I came across. So when it comes to warts and verrucases, people normally say that they have like deep roots that make them like hard to treat. And one thing I would say, no, warts and verrucas do not have roots. They actually reside in the top layer of the skin. Yes, treatments focus on like removing infected skin cells and stimulating like the immune system to fight the
Mhm.
virus. So people should not think that like warts and verrucas have deep roots, because like when I know when people say that, that's when you see them like cutting off like layers of their warts and stuff.
Mhm.
No, this needs to stop. This is how we end up hurting ourselves or spreading the infection more. So
Yes.
please, please, please do not be cutting them thinking that they have deep roots. So
Yeah.
no. So that is that one for warts and verrucas. The other myth I had was for calluses, and calluses, I do have that calluses are harmful and should always be removed. So what I would say in regards to this is that calluses and are basically the skin's natural response to repeated friction or pressure, as we've said.
Yeah.
So it's serving as a protective barrier.
Yeah.
They are not harmful and usually don't require removal unless they cause like this discomfort or pain. But
Yeah.
once you basically do what we've told you, like moisturizing, soaking it in water, that should be it. It shouldn't really require removal of it. Yeah.
Yeah.
So basically just taking care of your hands or feet is the most important when it comes to calluses. What are the myths or misconceptions that you came across, Trudy?
Um, well, I think we have debunked a few of them, which is that
Yes.
some people say, "Oh, that's a wart; it won't spread. It's not
Mm,
contagious. It's just a tiny little growth." And as
yes.
we have said, warts and verrucas, because of what causes them, which is a virus, they are contagious. So we did
Mm,
debunk that along the way. But one thing I've actually heard from patients is they've come in and they've been like, "Oh, I don't know, my grandchild has got a wart, and I'm just a bit worried. It might be reason. It might be I don't know, serious. It might be cancer causing, or it might
mm,
be a sign of cancer. Or
yeah.
my dad has got a wart. Is it a sign of cancer? No.
Mm,
Warts and verrucas do not necessarily mean that that is a sign of cancer.
mm,
As we've said, they are caused by a virus. So it could just mean maybe you need to up your hygiene game. But again,
yes.
we're not saying that just because you have a wart or a verruca, it could mean that maybe something else is not underlying.
Mm,
Always, if you're a bit worried about your wart or verruca, go see a doctor. And they will
yeah.
do the tests that they need to do just to make sure they eliminate everything. But
Mm,
I can assure you that they are not necessarily a sign of cancer.
yeah.
And lastly, one thing I heard growing up is that warts and verrucas are caused by frogs and toads. And maybe you did hear the same, like
Yeah.
when a frog jumps on you, you will get warts, because I think
Yes.
they've got very warty skin, isn't it?
Mm,
And that is unfortunately a myth, guys. Okay, stop telling your
Yeah.
kids, careful with that frog. If it jumps in,
Yeah.
you're gonna get warts. No, the frog is
Yeah.
not gonna cause someone to have warts or verrucas.
Mm.
It's definitely a myth. But that's
Yeah.
the only two that I've heard that we haven't really touched on.
Yeah.
But of course, if there's any myths you've always had about warts and verrucas, drop us an email, send us a
Yeah.
message, let us know these things. We need to help,
Yes.
not just you, but we need to help people who might have the same myths and misconceptions about some of these things. So it's very,
Exactly.
very important to share some of these things with us. And we promise we won't be judgy.
Yes. Mm-hmm.
Now, we've touched on pretty much everything, but someone
Mm-hmm.
might ask, when can I see a doctor? Like when my water is presenting or my verruca is presenting
Mm.
a certain way, can I see a doctor? And what is a
Mm.
certain way, Steph? Like, do you have what are your pointers to say someone who might be
Mm.
wondering, when can I see a doctor? When
Yeah.
verruca or my wart is, like
Mm.
what is your advice?
Okay. I think we've touched on this briefly. We have mentioned
Yeah,
it. So usually we normally advise patients. So the only time you come to see us first, yes.
yeah,
When you do find like a growth or something going on with your skin, if you don't
yeah,
recognize it, do come to us. We'll be able to differentiate it and let you know what it is. So always, always, if you're unsure of something, see a healthcare professional so that they'll be able
yeah,
to diagnose that this is what you have. But
yeah,
if, for instance, you do have warts or verrucas and this is becoming persistent, it's not going away, or it's becoming recurrent, like you keep getting it, do
yeah,
see your GP, especially if you've tried the OTC products, you've tried the
yeah,
home remedies, like none of that are working and they just
yeah,
keep coming back. That is a sign that there's probably like a problem and it needs further treatment. So that is
yeah,
the time we would literally refer you to your GP.
mm-hmm.
The other time as well where we would refer you to a GP is, let's say, for instance, your warts or verruca is very painful, or let's say, for instance, is bleeding. It's
Mm-hmm.
especially even with calluses, it's cracked and is bleeding, and
Mm.
these can actually also lead to like infections. So
Yeah,
when that happen, it does warrant like further treatment. So you do need to see your GP when this
yeah,
happens. I also mentioned earlier, let's say for instance, you have a wart on your face.
yeah,
Straight away, you need to see your GP because that means that you need to be seen by a dermatologist for them to help
yeah,
to do further investigations, or you may even need like different treatment as well. Um, Another group of people who we normally refer to the GP is if you have like a lowered immunity. Um, this could this could maybe be the cause of you getting the warts and the verruca. So if
because
you're someone with like a low immunity, let's say for instance, I don't know, HIV or something, or you're on like a medication that lowers your immunity, let's say for instance, like
mm-hmm.
chemotherapy or something, we normally say see your GP if that
Yeah,
happens. Yeah. Or if you have loads of warts covering like a large area, this also warrants you to see your GP. And if, say, let's say your warts or verruca changes in color or shape over time, this could mean that it's probably not responding to the treatment as well, whatever you're
yeah,
doing. So a
yeah,
GP needs to see it to again investigate or give you a different treatment option. And I mentioned this earlier as well. If you have diabetes or poor circulation, and you develop a foot callus or a wart or verruca, please do see your GP because it could mean something else. So it needs to be
mm-hmm.
again investigated. So these
Yeah,
are the main pointers I would say that warrants a GP referral. But are there
yeah.
any other reasons or group of people that needs to see the GP?
No, you've pretty much mentioned all of them. What I'd like to just say is, if you are worried about your wart or a verruca, or you're not sure if it's a wart or a verruca, see your doctor. So
Yeah.
anything that you're worried about, honestly, you might have treatment for it, or you might get treatment for it, but
Yes.
the worry will still be there. So it is worth just getting that sort of like, second, maybe just second opinion, and then that will probably calm you down. So anything you're
Yeah.
worried about when it comes to your health, when it comes to your skin, always see your GP. But you've pretty much
Yes.
mentioned all of them. So I guess we've pretty much mentioned everything when it comes to warts and verrucas and calluses. But of course, if there's any questions, we're always here. We're willing to explore this topic again if there's ever anything that, comes up. But as for now, Steph, what is your take-home message?
Yeah. So my take-home message is that warts, verrucas, and calluses, as we mentioned, are common skin conditions that, while usually they are harmless, they can cause discomfort and sometimes require treatment. Warts and verrucas, as we mentioned, are caused by the human papilloma virus and
Yeah.
therefore can spread through direct contact. While calluses, on the other hand, develop as a protective response to repeated friction or pressure. In all of this, prevention is key. Maintain good foot and hand hygiene, avoid walking barefoot in public areas, and wear properly fitting shoes. If the skin conditions become painful, persistent, or bothersome, please contact a healthcare professional for the best treatment options. But stay informed, take care of your skin, and don't ignore what your body is telling you. That is my take-home message. What would be your take-home message, Trudy?
You summed that up very, very well. But what I'd like to just very quickly add is, as we've said, warts, verrucas, and even calluses seem like small annoyances, but understanding them and their causes is actually key to tackling them. So knowing what is causing your wart and verruca, and also knowing what is causing your callus, is basically the key to even preventing them. And most warts and verrucas, as we've said, we've said in this episode, they are harmless and they can be managed with the right care. So early treatment can actually prevent them from spreading and becoming more persistent and even, just worse, basically. If you are in doubt, always consult a healthcare provider to determine the best course of action. But as you said, Steph, keeping clean and dry, keeping your hands clean and dry, having good hygiene is literally key to preventing warts, verrucas, and even calluses. So keep informed, but most importantly, keep clean.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week. Stay safe, stay healthy, and stay blessed.